Hey, this is Erin from Educated Nurse, and this is my lecture series on what it's like to go from an ER nurse to a breast cancer patient and survivor and back again. This next lecture is one of my favorite things to talk about, things that I've talked about at nursing conferences and shared my story. These are my top 11 things to never say to a cancer patient. Check them out. I do want to put a disclaimer out there that this video is for instructional purposes only. The information shared is my story, and it's not everybody's story. None of the information shared should be considered expert medical advice. The information presented should not replace the information provided by your doctor. Please work with your own doctor to find the best course of treatment for you for your situation. Also, I will use medical terminology which may not be suitable for children. And please also be aware that I'm very honest. I tell it how it is. I don't sugarcoat, and for that I apologize for the occasional profanity. All right, before we dive into this, I do want to just say, most people have the best intentions. They hear you're diagnosed with cancer, and that's how they look at you and think of you. They feel bad for you. They add you to their prayer list. They've seen someone die of cancer, so that's how they think you're going to look. They want to know how you're doing, and most people genuinely care or feel obligated to ask. In reality, we don't want to repeat our story 100 times, and we don't want to talk about cancer 24/7. So, the top 11 things to not say to a cancer patient. Number 11, please let me know how I can help. Oh, okay, sure. I'll just make a list of everything I need help with, and I'll mass email it to everyone. Right. Instead, offer to bring some dinner, mail a card, come over and cut the grass or plant some flowers, send gift cards, reach out to a family and ask how they can help. Most people want to help, and the response can be overwhelmingly wonderful. But by saying, let me know what I can do to help, it leaves the ball in my court. Going through cancer, I don't have time to make a list of the things that I need, and it adds pressure to find something for someone else to do. I was never one to ask for help, so this one was really hard for me. Many times I was adjusting to the new normal, and when I did need help, it was last minute. So when you're thinking about the person in your life that's going through cancer, plan ahead with a meal train or set aside some time on weekends to help with their kids or help around the house. That's a way better plan than having someone who's in the middle of treatment make a list of things that you need or they need from you. Number 10, do you think your cancer was caused by X, Y, Z? To be honest, the question, why me, is very real. I often caught myself having a pity party and blaming myself after we never found a cause. That's right, we never found a reason why I got cancer. Many patients have already racked their minds or are still battling with all the what ifs and whys. I had more questions than I had answers, and eventually I realized it was okay to not have an answer why I was diagnosed with cancer. And really, it wasn't going to change my treatment plan, and I didn't want one more thing to worry about. Instead, try and focus on the treatment and moving forward. Now, I will say with a caveat, if there's a genetic component to your cancer, it is important that you address that. Genetic relations to cancer are only about 10% of all the causes of why someone develops a cancer, only about 10%. 90% is not genetically related, but if there is a genetic component, you have to figure that out and potentially prevent other types of cancers. So I will just say that, but for the majority of patients, you might not ever figure out why you've developed cancer. So don't come up with a list of reasons why, like eating macaroni and cheese or protein shakes or not breastfeeding or blah, blah, blah. That can be damaging. Just focus on that person's treatment and moving forward. Number 9, I know someone who had cancer, you should do this. Unfortunately, everyone knows somebody who had cancer or who has cancer. There are more and more people being diagnosed with cancer every day, and it sucks. But I don't always want to hear about someone else's experience if there's a bad outcome. Focus on what I'm going through. Every diagnosis is different. Every person reacts to treatment differently, even with the same type of cancer and medications. What I'm going through is not the same as someone you know. Please ask how I'm doing and ask thoughtful questions about my diagnosis. Number 8, will you lose your hair? Again, every treatment is different, and depending on the length, course, and medication will determine if someone will lose their hair. For some patients, it's a very difficult topic. Having hair and boobs are features that make us women, and sometimes it can be a sense of femininity. It's a source of beauty and confidence that will be lost in a relatively short period of time. It's dramatic and scary watching your hair fall out in clumps, and it's not something we're prepared for or looking forward to. When this happens, I found that retail therapy can be helpful and a good source of distraction. Go find a hat, a scarf, new clothes, or makeup to celebrate your beauty, even if you lose your hair. Number 7, you're so strong. You can fight this. You can beat this. That's hard. Sometimes a strong image can be helpful, but on days when you don't feel well, this can be hard to not be able to live up to that. It made me feel like I couldn't even be vulnerable or have a bad day. No one loses their battle with cancer because of a lack of trying. People lose the battle when treatment stops working. It's more important to notice when we've handled situations with grace and style, and please allow us to have good and bad days. Number 6, everything is going to be fine. Oh, really? Do you have a crystal ball that I don't know about? No one knows this. Doctors don't know this. After being diagnosed with cancer, most patients will have a varying amount of fear that they will live with for the rest of their life. Fear of reoccurrence, fear it's not fully gone, fear it will spread, fear that every bump, lump, pain is cancer returning. I will tell you that being 8 years out, I still get afraid every time my 6-month oncology appointment rolls around. Every time I have a new pain, I wonder, oh my God, is my cancer back? Do I have bone cancer now? And there's going to be another lecture on that in a little bit. But don't be dismissive and don't say everything is going to be fine because you do not know. By using this kind of blanket statement, you're actually dismissing feelings. Offer your support. That way, if we get a good news, we can celebrate. And if bad news arises, we can cry together. Number 5, I think we should talk about it. This drove me nuts. Most of the time, we don't want to talk about it. Cancer is already consuming life. Let's not talk about it. Let's talk about anything else. Let's talk about work, your summer plans, gossip, the weather, anything. Some people need to talk about it and they want to talk about it. Ask. Anything else though, let's talk about anything else just to get our minds off cancer for 5 minutes. We are still people and we want to catch up and gossip and chat like everyone else. When we're ready to or need to talk about it, we will. Until then, treat me like a normal person. Number 4, nothing at all. Silence is just as bad as the rest of this list. It's understandable that many people are sad and afraid and don't know what to say. And I will say one of the hardest parts for me was losing friends I thought I had because they disappeared and didn't know what to say or do. Don't ignore the situation. I personally found a lot of resentment towards people when they vanished from my life during treatment and came back when I was done. Offer your time and ear for whatever someone wants to talk about. Number 3, everything happens for a reason. No, it doesn't. I used to believe this statement as the stars seemed to be aligned one morning when my mom saved my dad's life by doing CPR when he went into sudden cardiac arrest. But I don't know if I believe it now. For those that look to a higher power and believe that this is some part of a plan, it's a shitty plan in my opinion. No one wants to leave this earth before their time. I don't want to leave my husband and my kids behind. I don't want to miss their graduations, wedding, grandkids. If there's something I'm supposed to learn from this experience, I hope I learn it, the cancer leaves, and I can move on. I want to make the best of my life. Don't tell me that this has happened for a reason, because that's a shitty reason. Number 2, it's just a bump in the road. I heard this all the time. Yes, it's just a bump in the road today. Tomorrow it's another bump or setback or complication. By next week, it's going to be a freaking obstacle course. Every time I heard it's just a blank, I wanted to scream. For me, every treatment followed something else. Everything was a domino effect, and I tried my hardest to stay on track. For example, I couldn't get surgery until chemo was done, so chemo had to stay on track. Then when surgery came, it got pushed back a week due to my surgeon's schedule. Fine, whatever, it was just another week. Well, really, it was more than that. It meant I was pushing back radiation, reconstruction, and most importantly, getting treatment done with and on with my life. Lastly, when I got my radiation schedule, I was so excited. If all worked out and I didn't fall behind, I would have ended on my 34th birthday. What an amazing thing to celebrate, right? No more cancer. Well, I missed one day for the radiation machine being down, and that pushed back everything else. I ended the day after my birthday. Yes, bumps in the road happen and there's nothing you can do about it, but don't blow it off. One less chemo, one less doctor's appointment, or one less day of radiation, it's a big deal. It means you're one day closer to a normal life again. Lastly, well, you don't look sick, you look good. Gee, thanks. This was hard. It really was. At first I thought it was flattering. I took it as a compliment. I actually thought, well, maybe I don't look so bad. Then reality started staring me back in the face. I know people mean well, but over time I got really annoyed. I saw a really funny quote during treatment, and it said, I don't look sick and you don't look stupid, but looks can be deceiving. But really, what am I supposed to look like? I know cancer is an invisible disease, but I have real symptoms and feelings. Not every cancer is a death sentence, and while most people may have that image in their head, that's not always the case. It's hard to see the effects of chemo has on your immune system, your memory, and all your internal symptoms. Our scars are hidden. You don't see the images or thoughts constantly flooding my brain. And while I feel like shit on the inside, I'll just smile for you on the outside so I don't look sick. Going through cancer, chemo, radiation, it's an emotional and physical roller coaster. There are good days and there are bad days. A person doesn't have to look sick to be sick. Instead, ask me how I'm feeling and be ready for that answer. One of the best tips I got was from another survivor, and they told me to start a Caring Bridge site, so I did that. It was a way for me to let people know how I was doing. In this way, you don't have to talk, you can write how things are going, and it reaches the masses. When you're in large gatherings, such as holidays, come up with a positive statement and have an action plan to divert the conversation by asking another person something about them if you feel like you don't want to talk about things. That's okay. And if push comes to shove, write your answer down on a sign and wear it around your neck so you don't have to repeat yourself. No, I'm not kidding. I seriously contemplated this for one of my family holidays because people kept asking, how are you doing? How are you doing? And man, wearing a sign around my neck would have just been wonderful. Now, I had some humor in these things, and I understand that it might not be easy for everybody, but these are some things that I found when I was going through my journey that were super helpful. And hopefully, if you have someone in your life that's going through cancer, you think about some of the things that you're saying and doing and how it might be damaging and things that you might be able to do to make their life a little bit easier and this whole situation a little more tolerable. If you want to learn more, check out my book. I wrote this while I was going through cancer treatment as kind of for a way for me to process things. And I found afterwards that it actually could help other people. So my book actually goes into a lot more details about my journey and just some tips and tricks that I learned along the way. You can check it out. It's available on Etsy, in my Etsy shop, and on Amazon. Thanks for listening, and make sure to check out the other videos in this series.